Ladies, are you over the age of 35? And have you suddenly started to feel more tired, irritable, or forgetful lately? Or have you been having trouble sleeping? Or do you just feel like something is off within your body and you cannot figure out what it is? You're probably thinking, is it stress? Is it aging? But I'm doing this video for you to share with you that it just might be perimenopause. Now, as a doctor, I'm an internal medicine doctor and a woman going through perimenopause myself. I know how frustrating this season can seem. Previously healthy, and then all of a sudden it's like the things that were working before for controlling your weight aren't working anymore, and now you're gaining weight around that midsection. You're having trouble sleeping, like all of that. Been through all of that. So you're not crazy and you're not alone. So in this video, I'm going to break down what's happening when you go through perimenopause. I'll go through the signs and symptoms that you could be going through perimenopause. I'll talk about some of the treatment options, including natural remedies as well, dietary things, and what you need to know basically if you're over the age of 35 and you're a woman. I would say age of 35 to about 50, 55 or so. This is going to be really important. Okay. So let's get right into it. So when people think about perimenopause, I think most people probably think about menopause, the time when your periods actually stop. But there's a period where it's more symptomatic than that, actually, and that is the period before menopause. And that period is called perimenopause. Perimenopause is the transition or the period leading up to menopause. And during perimenopause, your hormones are actually fluctuating. So it's not a steady decline in estrogen like there is in menopause. Your hormones are actually fluctuating. So, here are some details that you want to know about perimenopause. It typically starts in the 40s, but some women do notice changes in their late 30s or as late as early 50s. Perimenopause can last anywhere from 4 to 8 years, but for some people, it can extend beyond a decade. And during perimenopause, your estrogen levels are fluctuating. And it's also important to note that menopause is a period when a woman has gone 12 months without a period. And it's funny because I remember when I went to my primary doctor and then I saw an OBGYN and I was asking them, could I be going through perimenopause? And they both asked me, am I still having periods every month? And I said, yes. And they were like, well, you're not going through menopause or perimenopause. It basically was like, it's nothing to worry about, basically. But I did not stop there. So I just want to put that out to you that if a doctor or somebody, a provider asks you, are you still having periods? That's the wrong question to ask, because when you stop having periods, that's actually more menopause. Menopause is when you're not having periods for 12 months. But the period before that is probably more challenging for most women, and it's time that is not really talked about much. And honestly, there's not much. I'm an internist and I don't remember a lot of training about menopause and perimenopause in my training, and it's obvious that my family medicine doctor and my OBGYN doctor also didn't know much about it. So I'm just saying that just because I keep it 100, generally speaking, in my experience, unless you see a certified menopause specialist, they can be a physician or a non-physician, the provider you're seeing is probably not going to be as knowledgeable about perimenopause and menopause. So what I'm sharing with you is what I've learned from having to study and learn about this myself, for myself, basically. So I'm just keeping it real because that's I keep it real. So menopause, like I say, is a period when you basically have not had a period for 12 months. The average age of menopause is around 51 years old. The estrogen levels stay low and fertility is unlikely in menopause. Whereas during perimenopause, it's still possible to get pregnant, although the chances are lower than in the younger years. Okay, so the hormone changes. So let's talk about the hormone changes because this can make you feel like you are like so irritable, you're moody, you're like, what's going on? So the estrogen levels fluctuate. They can go up and they can go down. This can cause hot flashes, mood changes, and irregular cycles. The progesterone levels decrease due to fewer ovulations, leading your periods sometimes to be heavier or irregular. Also, testosterone declines, which lowers your sex drive, affects your libido, basically your muscle tone and your energy levels. And then FSH and LH rises as the body tries harder to stimulate the ovaries. Now, generally speaking, perimenopause is a clinical diagnosis. It's not something that requires testing of hormone levels because, like I say, if you check estrogen, it depends on when it's checked whether it's going to be up or down. So the information that it provides is probably going to be less useful. So you don't need blood tests to diagnose perimenopause. It primarily should be clinical diagnosis based on symptoms. When I went to my perimenopause specialist or menopause certified specialist, she's an OBGYN doctor who has additional training in perimenopause and menopause. And the difference in information that she provided with me was a stark difference between what I was getting from my primary doctor and my OBGYN doctor. And all of my doctors are great. So this is not a knock on them. This is just what it is. Um, so I'm in perimenopause, have been in for a few years now, and I've not had my hormones checked. I've asked all of my doctors whether they thought it was necessary, um, including my menopause specialist doctor, and I believe her. And then when I looked it up, I agreed that it really was not going to add any additional information based upon my clinical symptoms. We're pretty certain that I'm in perimenopause. I don't need testing to prove it. And I'm on treatment for it. Right. So I just wanted to say that because I see sometimes people on the internet say, oh, well, you need to check your hormones, get your hormones levels checked. And that's not necessarily what's needed to be done in every situation. But what I do highly recommend is to see a certified menopause specialist. And you can go online to the website and find someone in your area who has done this certification. And it's something that's done after residency, or if it's a nurse practitioner or a PA, it's something that's done after they've graduated. So it's like a certification. Okay, so what are the symptoms? And this is so important because it's so crazy. I didn't even realize that this was what I was dealing with at that time. I was just thought it was just like stress. It was around the time of the pandemic, right? And I just thought it was like stress. So these are the symptoms. Hot flashes. Now, you may or may not have hot flashes, but you might start to have night sweats. And it doesn't have to be every night. It could be like occasionally. But if you're having any night sweats or any hot flashes, even if it's once a week, twice a week, that's something to let your doctor know about and to make note of. Brain fog and problems remembering things. So a little bit of forgetfulness, maybe like something minor, nothing that's, dramatically altered your life. But if you're noticing more problems with your memory, problems focusing, that could be a sign that you're in perimenopause. Weight gain. So if your weight was previously controlled on your diet or exercise and whatever you're doing, and then now you notice increased fat around your abdominal area, so the fat distribution changes when you start to go through perimenopause. You might also experience joint pain and body aches, problems sleeping, so either difficulty falling asleep or problems staying asleep. You might also notice vaginal dryness, changes in your libido, as well as palpitations. You might also experience mood changes. So, if you're experiencing new anxiety, new feelings of unhappiness or sadness, depression, new irritability, or feeling a lack of fulfillment in life, just different things where you just feel like something is off, these could be signs that you're going through perimenopause. And then also, your periods can be irregular. So, either your cycle is shorter. So, let's say normally your cycle is every 28 days, it may be shorter to every 21 days or it may be longer, or your menstrual period may be come either heavier or lighter. So changes in your periods and irregular periods. So I just wanted to cover the symptoms because some people may not be aware of them. And the only thing that people might think about is, okay, well, are you still having periods? Well, yeah, you're still having periods, but that does not rule out perimenopause. So hopefully that's clear in your mind and you're kind of making a note of, do I have this? Do I have that? Okay, so next I wanted to touch on the health implications when women go through perimenopause and towards menopause. Um, the fluctuations and the gradual decline in estrogen does have some consequences, such as increased risk of osteoporosis, increased heart disease risk, so there's a cardiovascular risk, increase risk of insulin resistance, as well as metabolic changes that can increase the risk of diabetes. And then mental health, there's an increased risk for anxiety and depression. Why am I saying this? I'm saying this because I have literally seen people who are living a healthy lifestyle, have a healthy weight and everything. And then once they hit that perimenopause years, the A1C starts to creep up, the cholesterol starts to creep up. The closer they get towards menopause, they start to gain weight and they are not able to lose the weight as easily as they had been before. And even sometimes, yeah, people don't even really think about it. Even sometimes providers don't even think about it. But these are possible signs that you might be going through perimenopause. Okay, so now we've touched on the symptoms, we've touched on the implications of perimenopause, the difference between perimenopause and menopause. Now, I'm going to go into some holistic strategies for managing perimenopause. Now, those of you that are new here, you've been following me for a while, you know that I'm a board certified internal medicine doctor, as well as certified in lifestyle medicine. And for over 10 years now, I have been teaching and helping people to live healthier lives from the inside out with a complete mind, body, spirit approach. And I myself am going through perimenopause now and did not realize it until a couple of years later. And so that's why I'm sharing this information because it's something that could easily be dismissed as stress. And especially if there's a national or global situation going on that's causing stress, you might think that it's just that. But it could be partially, the changes that you're feeling could be partially related to perimenopause. So this video is just to kind of make you aware of that so that you can have that on your mind when you go to your doctor, and then also to challenge you and to encourage you that you might want to consider seeing a certified menopause specialist. Okay, so certified menopause practitioner, and the website I wanted to share with you is menopause.org, and you can search for a provider practitioner in the country. Okay. All right. So, what are some holistic strategies for managing perimenopause? Of course, you don't have to touch on nutrition. I am plant based, advocate for a plant forward diet. So, healthy foods are always going to be of benefit to you. Foods that help to regulate your hormones, balance your hormones, adequate fiber, making sure you're getting at least 20 grams of fiber a day. Consider eating foods with omega 3s. That's going to be good for heart health, as well as soy is going to be good as well. Um, for nutritional balancing, and eating a healthy diet that's high in fruit and vegetables, low in processed foods, low in added sugars is always going to be beneficial because you want to lower your risk of diabetes, metabolic conditions, as well as heart disease. So, a healthy diet is, of course, key. Second thing is stress reduction. There are so many modalities for stress reduction, but some of my favorite are meditation, sitting still, quiet, meditating on something. You can go on YouTube, you can meditate on scripture, whatever appeals to you. Deep breathing is also good, or breath work. And there are breath work videos on YouTube. There's different relaxation techniques. Walking outside in nature, exercising is good for stress reduction. Prayer is actually a form of stress reduction as well. So, engaging in these activities, these things every single day can help to lower your stress levels, help you to feel better. The third holistic strategy for managing perimenopause is exercise and movement. So, it's really important to get strength training and to get cardio activity regularly during the week. That could be walking, running, exercise class, whatever interests you, but it's really important to get regular physical activity several days during the week. Schedule it into your schedule so that you don't miss it, so you don't forget it. It's really, really important. A regular exercise also lowers your risk of breast cancer as well. So that's really important to note. The fourth thing is sleep hygiene. So getting adequate sleep. You want to make sure that you're going to sleep at the same time every night, that your bedroom is conducive to sleep, meaning that it's dark, it's a little bit cooler, the TV is off, and you've stopped using your electronic devices about an hour before bedtime because the electronic devices, the blue light, inhibits melatonin release and actually makes it more difficult for you to get to sleep. So I always recommend to people to turn off the phone or stop using the phone, watching TV about an hour before bed. I know it's hard. I know it's hard. Trust me, because sometimes I be wanting to be on my phone scrolling at nighttime, and I have to tell myself, no, turn the phone or put the phone down. I mean, read a book or something like that instead if you need to. All right. So the fifth thing to consider is hormone therapy. And I wanted to touch on this specifically because there was a lot of hesitancy about hormone replacement therapy from years ago, right? From this study that later it came out that there were some problems with the study. So some providers are still afraid to prescribe hormone replacement therapy, but generally speaking, current data shows that hormone replacement therapy is safe and can be very effective for managing symptoms and help to get you back to feeling more like yourself. However, it is not for everyone. So I'm just going to give you just some ways that it can benefit, some of the risk of it, and again, strongly encouraging you to see a provider. This is not medical advice. You need to see a provider who can go over your history and determine whether whether you're a good candidate for it, whether it's something for you. So the benefits of hormone replacement therapy are it can basically help reduce your symptoms. Like there are so many people who once they started hormone replacement therapy feel like a new person. It can help with hot flashes, night sweats, sleep problems. It can reduce the mood swings and the brain fog. It can help improve the bone health, reducing the risk of osteoporosis, and it can improve vaginal dryness and discomfort. There are pills, patches, there's different forms of it. So definitely speak to your provider about that. Although I have to add, obviously, it's not a option or not recommended for every single person. There's risks to every single medication. So those do have to be weighed. If you're someone who is over 60 or you have a history of blood clots, or maybe if you have a history of breast cancer, those may be reasons to kind of caution and maybe consider whether that's something you really want to go on, maybe not go on it. But again, this is not medical advice. This is something to discuss with your doctor. But those are the risks, potential risks are those small. Okay. So there's that. Definitely want to put a plug in for hormone replacement therapy because I think it has gotten a bad rap over the years. But I think now, if you talk to any doctor that's well versed on menopause and perimenopause, they would tell you that it helps significantly with the symptoms. And in many cases, the benefits outweigh the risk. But it's important to start it during perimenopause, like not once menopause has well set in. It's better when it started earlier, right? Like 10 years before before menopause. So that's why I'm saying this to you. If you're 35 to 50 or so, you're in that window of perimenopause. So if you're having any of these symptoms, what I highly recommend that you do is make an appointment. You can see a primary doctor or an OBGYN first. But if you're like me, you may find that they're not as knowledgeable about it, which is okay. I wasn't as knowledgeable about it, even myself as an internist. You may need to see a certified menopause practitioner. Okay, just have to put a plug in there because it was just night and day. Like her confidence level, her knowledge. Like I learned so much, and the visit was like 40 minutes, and yeah, I learned so much from it. It was so beneficial. So yeah, that's the amazing thing about medicine. It's like a lifelong journey to continue to learn and to continue to grow. I also read this book about menopause by Marie Claire Haver. If you're interested, it's very readable, even for people that are not healthcare professionals. It's called Menopause. I think that's the name of it. I'll put that in the show notes too. But that was a good book. It's on Audible as well. So yeah, there are a lot of resources out there, but you don't have to suffer alone. You don't have to suffer through this difficult period. That's what I wanted to say. And don't let anyone tell you that, oh, this is minor, this is just normal life, this is just being a woman, you should just deal with it. Like, if there's treatments for something, why do you have to suffer? Why not see a specialist and get the treatment. So that's all that I want to say. Because I even had somebody who's an OBGYN, a friend of mine, be like, oh, but this is just normal um, women hormones, aging, whatever. And she's a bit older than me, like I think 50, right? So I guess she didn't really have that much symptoms. But again, everyone has different symptoms. Somebody goes through perimenopause and there's really nothing. It's like a walk in the park. And then somebody else may have like all the symptoms in the world and feel like they are a whole completely different person. So no one can tell somebody else whether they should just deal with it, right? So that's all I want to say. I just want to reassure whoever's listening who may be like, oh, well, this is just normal. I should just deal with it. It's just a normal part of life. Well, some people have it milder, so they may say that, but some people may have serious symptoms where they feel like they are so irritable and they don't even know what to do with themselves. And again, if you're dealing with these symptoms, like I say, I'm just going to go over them really quickly again. Um, Brain fog, memory problems, problems sleeping, irritability that's new, feeling extremely annoyed at every and everything, not feeling fulfilled in life, probably feeling unhappy, gaining weight around your midsection, um, vaginal dryness, changes in your libido. These are common symptoms of perimenopause, as well as hot flashes, night sweats, and changes in your period. And looking at this, like when I saw this list, I was like, oh my goodness, I have gone through like all of these things. I still have night sweats. It's not every night though, it's a couple times a week. Um, and I noticed I've never struggled with excess weight. However, when I started to go through perimenopause, I started to gain weight around my belly, and I was like, "Why is my belly sticking out now?" And like my diet hadn't changed. I'm still exercising the same amount. Nothing had changed, so there's no reason in my mind for me to be all of a sudden be gaining weight around my midsection. And then when I put all the dots together, I was like, "Ooh, now I see what's happening." I was having trouble sleeping as well, like staying asleep. Um, I still wake up during the night. I'm like, how much longer is this gonna go on? I wake up once during the night, and the weight gain thing, I solved that problem because I started doing intermittent fasting. So I eat 2 meals a day now and I fast a lot more. So that belly went away. So now my belly's back flat again, like how it was before. So I'm happy about that. Um, yeah, and the irritability, that was weird too. But like I say, I now am taking hormones. So um I'm due to get my blood work checked though for, like metabolic stuff, like diabetes and all that, cholesterol, due to get that checked. So hopefully this was helpful. If you have any comments, questions, let me know below. Like this video. Be sure to subscribe to the channel. If you're new here, definitely helps it to grow and helps more people to see the content. Again, I am a physician and faith-based, wellness-based content creator and entrepreneur. And I, on this channel, aim to educate, I was going to say women, but it's really not just women, it's believers primarily, people in the body of Christ, about holistic wellness as well as spiritual growth, faith, and purpose. Those are the main topics that I touch on. And if you found this video helpful, you definitely want to check out this video here about brain fog, sugar, and spiritual clarity. Is your diet related? Super, super interesting. All right. Thanks so much for watching, and I'll see you in the next video.